The maternal-fetal medicine is essentially taking the medical complexities of adult medicine, diabetes, high blood pressure, heart disease, and applying the knowledge of how to care for those adult patients when they are pregnant. So there's really two camps of cardiac complications that can impact pregnancy. One is rhythm issues, and the other can be issues related to how well the heart is pumping. People who have an arrhythmia will often present with symptoms synonymous with palpitations, or what are called skipped beats, and they'll feel that the rhythm of their heart is out of sync. On the other camp, women's hearts that are maybe not pumping as efficiently or as strongly as they should will often present with signs of feeling as though they can't catch their breath or have a lot of exercise intolerance. Patients sometimes will present with new symptoms in the pregnancy that they'd never had before and undergo evaluation where we identify that there's a problem with their heart. Oftentimes women will present to pregnancy already having established an issue or a condition with their hearts where we are essentially picking up the pieces and saying, okay, with this history, here's how we're going to manage your pregnancy moving forward. Certainly a woman who is kind of getting by in the non-pregnant state without any sort of symptoms, then is now faced with the added work and the added demand on her heart that pregnancy poses. And that often can unmask a lot of these symptoms because she was operating kind of at her maximal capacity before pregnancy, and then the physiologic demands of the pregnancy have now kind of tipped the scales such that she's not able to meet her needs, and all of a sudden these symptoms can start to develop. A woman should watch for chest pain, a sense of the heart beating in an irregular pattern that lasts greater than a few seconds, increased inability to tolerate any sort of physical exertion. When she's coughing, she is coughing up any sort of sputum or any sort of productive fluid that could potentially indicate that there's fluid backing up in the lungs. Difficulty in catching your breath when you lay down flat to sleep at night. Those would not be normal symptoms for pregnancy. So here at the TriHealth Center for Maternal Cardiac Care, we bring a multidisciplinary group approach to these patients that says, hey, we're going to give you one message from cardiology world, sometimes anesthesia, maternal-fetal medicine, sometimes cardiothoracic surgery, all together in the same visit so that the patient leaves feeling as though she's heard one management plan, one risk assessment, and can leave feeling good that she's heard the input from all of these specialties in collaboration. For decades, TriHealth and specifically Good Samaritan Hospital have been considered the place to have a child in the Cincinnati region. And that's not only because we have an expert NICU, but also because we've had decades of maternal-fetal medicine experience that really approaches all of those high-risk pregnancy aspects in a very programmatic and multidisciplinary fashion to bring all of the specialists to the patient in one setting to provide expert care.